This is Margaret Salisu Horodin. Welcome to Senior Care Resource Center. Today we're going to be talking about avoiding medication errors. What causes medication errors? What are the ways that we can prevent medication problems among the elderly? Medication errors are common in the elderly, and the factors responsible for the errors are not far-fetched. For example, old age, memory loss, could significantly affect the number of medications that the elderly take. In terms of being diligent about it, knowing the numbers and all that. Most importantly, on average, seniors take 6 to 8 medications, prescribed medications. And most of them at times, they supplement with over-the-counter drugs. When you add all this together, on average, seniors take 12 to 40 medications on a daily basis. This is enough to cause confusion and also to make them to forget about their medications. And the role of family members in monitoring medications for the elderly, especially prescribed medications, cannot be overemphasized. When you talk about medication errors, you want to look at the prescribed medications, which most of them do take as a result of coping with chronic illnesses and living a dignified life. Family members should watch out. This is very important. Seniors tend to rely more on the advice of family members than the advice that they receive from their doctors. And family members should be very careful in making sure that they provide the right information to the family. For example, you have to know the condition of your loved ones and equip yourself with all necessary information so that you do not misdirect them, even though you care for them, you love them, and you want them to live a good life. At the same time, it's very dangerous to provide them with misdirected information. That is why it is important, if you need to give them advice, make sure you have the correct information. The other area that we need to be attentive to is the use of supplements, especially herbal supplements. Compared to the younger ones, herbal supplements can cause dangerous reactions when taken with prescribed medications. The younger one can benefit from herbal supplements such as ginkgo biloba, saw palmetto, but for the older person, this can negatively react to the prescribed medications they are taking. That is why if you need to take any any herbal supplements with your prescribed medication, you need to seek the advice of your doctor. You need to let your doctor know about it so that he can advise you whether to take the herbal supplement or not. One other important factor to consider, especially with the elderly, is old age and drug reaction. As we age, the body tends to slow down in the way that in the distribution and the elimination of drugs. Many drugs like Valium, they build up faster, but our body slow down in the consumption of it. And that is why it is very, very important that we are aware of the interactions of herbal, over-the-counter medication, and prescribed medications. For someone that is on any prescribed medication, you have to pay good attention to your body symptoms or body language. For example, if you are on a new medication, prescribed medication, and you notice some signs that we're going to mention in a little while, you need to let your doctor know about them, about the symptoms. For example, you're just on a new medication and you notice a change in mood. You are a happy-going person and suddenly you realize that you're very depressed, you're very snappy, you are restless, you have delirium. You have to let the doctor know. psychological symptoms cannot be ignored. Most of the time when your doctor, if the medications are important, they will continue with it, and they may prescribe you with other medications to help suppress the psychological symptoms, but they cannot be ignored. Other factors that can interact with prescribed medications are the use of alcohol intake. As we age, we have to be very careful about the amount of alcohol that we consume. That is why if you know you need to consume alcohol, you have to let your doctor know, so that the doctor can advise you on the interactions that could occur when you continue to take alcohol. It could also be reduced. Also, poor nutrition, your food intake, can interfere with medications. Most of the time, prescribed medications need to be taken with food. So if you are not taking the medication, if you are taking the medication on empty stomach, they can cause some problems. Hormone imbalance is also a factor that needs to be looked into. Apart from this, we want to look at what are the role of family. What can the family do to help the older person avoid problems that are associated with medications? We know that as old people, as the older adults, as they age, they may tend to need more medication. For example, someone with cancer may need medication to suppress the symptoms, or someone with chronic disease like diabetes, they may need to take some prescribed medication to monitor their blood intake, or someone with hypertension, they need to take some medication to control these problems. But then, these medications are important, but they need to be taken in the correct way or in the correct manner. So family members can play a significant role. One of the roles that you can play as a family member is to have the list of all the medications that your loved one is taking, including over-the-counter medications. It is very important to have the list handy, to make the list available to your doctor and to the pharmacist, and also to have the list of the medications handy in the event of an emergency, a trip to the emergency room, and situations that will warrant examining or looking at the medical condition of your loved ones. In addition to that, it is one important factor that we need to be very aware of is to avoid the use of multiple pharmacies. Stick to one pharmacy. Why is this important? The pharmacy that you're using will have a record of all your medications. They will be able to tell you the medications. If the doctor has discontinued the medication, you will be able to avoid the use of that. But if you have multiple pharmacies, you may be taking medications that have been discontinued, or medications that are actually the same but have different names, but they do perform the same function. So it is important that you stick to one pharmacy. The pharmacy that you use will also advise you. They tell you if over-the-counter medications are good for you, the interaction with the prescribed medication that you are using. So stick to one pharmacy. Also, you can help an older person, who is taking medication, help them to avoid medication error, especially if they're having cognition problem. For example, you can help them to have the medication in a daily dispenser box, something like this. You help them, you put the medication, if they are taking one in the morning, in the afternoon, you put them in the box so that it will be easy for them to take when they need to. Remember, some of them take an average of 6 to 8 medications a day. So keeping tab of all this could be a cumbersome adventure. But when you have them neatly packaged in a box for them, they just know that, okay, in the morning, 8 o'clock, they need to take their medication. They open the box and they pour it, they take the medication. So you can help them to simplify the task by putting in the dispenser box. Also, very important to have a family member, designate a family member who will be responsible to call or to physically examine, physically monitor the taking of the medication to make sure that they are taken on a daily basis or as prescribed. What about family member that is not around. We're talking about long distance family member. They can also help, because a situation may come up where you may not be at home or you just live far away, but you want to make sure that your family members are taking medication as prescribed. One of the things that you can use is to have alarm pill boxes. You can have an alarm clock, and in the clock you set an alarm. For example, if they are to take their medication at 8 o'clock in the morning, you set the alarm at 8 o'clock, so that at 8 o'clock the alarm will sound, and that will be a reminder for your loved ones that this is the time to take medication, and if they have to take it 2 or 3 times a day, you do likewise. You can also get them a medical alarm bands that is wrapped around their wristband, so that when it's time for them to take the medication, the alarm will beep and they will know that. One other way is if you have the computerized pill box dispensers that will ring a designated number whenever the pills has not been taken. So it is very important to have this handy. One other significant factor, especially right now that we are in the technology age, is to use a device that is called home telehealth. The home telehealth is a device that was set up by the medical professionals in the home. This device enables providers to monitor things such as medication, blood pressure, and to make sure that they are taken as prescribed. I hope this information is useful, and we would be in touch with you at another time. Thank you.